Imagine the ultrasound which you would normally use for a diagnostic application, which is the wide beam of the ultrasound which reaches your body. And take this ultrasound and focus on a small, tiny little spot. What will happen in this situation, that all energy from the ultrasound will be condensed only in one tiny area, and all the intensity of the ultrasound will start interacting with the tissue. And in this situation, this tissue will actually be destroyed. So in a sense, it is a ablation or removal, destruction of the tissue inside the body, which is fully non-invasive. However, this technology has some limitations, and the limitation is like, imagine that you are doing the gardening and weeding in your garden. So if you don't cut the roots and you don't remove the seeds, they will come back. The same is here. The HIFU, high intensity focused ultrasound ablation, cannot remove everything. And that's why we combine it with the nanomedicine. But in the nanomedicine, what happens, if you try to infiltrate the tumor, unfortunately nanoparticles cannot penetrate more than 200 to 400 microns from the blood vessels. So in this situation, what we do, we use the plane wave ultrasound, which kicks the nanoparticles and try to pushes them into the entire volume of tumor. Then we switch from the plane wave ultrasound after the infiltration to the focused ultrasound, and we break open individual nanoparticles and release the drug only on the spot. So in this situation, we combine ablation, thermal ablation, with the localized delivery of the drug. But also what happens with the ablation, the thermal ablation, the immune system in our body is activated. So in this situation, we are combining three modalities: the thermal ablation, localized and targeted delivery of the drug, and the activation of the immune system. And this is all required because our tumor is heterogeneous and responds differently to each of the modes of the treatment. So we want to achieve the synergies of all three modalities.
So while animal models are usually considered the gold standard in determining efficacy of different therapies, animal physiology is not the same as human physiology, and this reduces translatability of the results. To overcome this and enable personalized treatments, we've developed human physiology mimicking models. Oops, here we go. So these models allow us to create mini organs, shown here, more specifically mini tumors or cancer on a chip, using tumor cells derived from patients. Using these models, we're able to determine the efficacy of each of the treatment modalities individually and in combination, and subsequently define the most effective combination for each individual patient.
So our technology is actually non-invasive. It doesn't require very expensive operation theaters. It cuts a lot of cost which is associated with the personnel which is in the hospital, but really very importantly, it reduces the bio waste. It actually doesn't produce any waste which is associated typically with a normal surgery. But more importantly, we engage in a collaboration with the business school, and in our team we have the Professor Steve McGuire, who is the Professor of Engaged Innovation Scholarship, and we will implement the Innovation Scholarship into an entire project to make sure that the social economic benefits of our projects are maximized.